List those things that are most important to you. Your family, your friends, things that you like to eat, things that fond memories that you have. He said, list all these items. And then one by one, take away a memory. Take away one of your children, knowing that you will never hear or see them again because your mind will not allow you to.
My name is Arthur McCaffrey, and I was diagnosed with Alzheimer's disease a couple of years ago. Well, I started noticing it when I was working. I was forgetting to make appointments and to answer phone calls and get back to people and that kind of thing. And my production had begun to drop. So finally, my boss said, "This isn't working out. We're going to let you go." So at that point, I got some help and began to find out what was wrong with me.
By far and away, the most common first symptom is difficulty forming new memories. And what patients and often their caregivers usually mention is that a patient will start repeating questions, asking their loved one, what are we doing later today? And the loved one is like, we just had a whole conversation about that, don't you remember? And so just things like that are evidence that an event that happened or a conversation that happened did not get written in the patient's brain.
Went to a neurologist, and he evaluated me. He told me that he diagnosed me with early stage Alzheimer's disease.
So the question of staging, technically speaking, there are 3 stages. The Alzheimer's Association recognizes. There's rumors that they're going to go to 5 stages, 7, 9, whatever. I think it's just going to be more confusing than anything else. And then it begs the question, so what? I mean, what's the value of having a precise knowledge of what the stage is, especially when people are kind of merging in and out of stages at all given times?
Alzheimer's disease itself does not know what different stages are. It's a long, continuous process that doesn't necessarily have discrete stopping points along the way. I think the disease itself is a continuum. One of the big things that we've learned over the past decade or so is the fact that Alzheimer's disease, the process starts in the brain probably at least a decade, maybe longer, we're not actually sure, but probably at least a decade before the first time somebody loses their keys.
It was a gradual decline, and there wasn't any one thing that I took strong notice of. I think the thing that really helped me the most was coming home from an Alzheimer's meeting after having attended them for a few weeks, and then having totaling my car. That was just so clear for me.
It's watching oneself deteriorate is very humbling and very scary. And I think that patients go through anger, denial, all the things that you would expect during a grieving process.
I was angry. Yeah, I was very angry about it. I was incredulous about it.
There is no cure for Alzheimer's yet. It is one of the top It's the only top 10 disease that has no prevention and no really effective treatment.
Patients always ask what's likely to be in store for them in the next year or two. How fast are they going to decline? When are they going to die? And doctors hate to answer that question because it's really hard to predict. What I always encourage patients to do and their loved ones is to reflect on the previous couple of years. And usually upon reflection, they'll notice, often in retrospect, that the rate at which symptoms developed was very insidious and very slow. And I tell them that, that rate is likely to continue in a relatively linear fashion. Things are likely to get worse over time.
They're going to lose their total identity, and it's going to really affect you. So you need to know that it won't get better. It's going to get worse.
Alzheimer's disease is the most common form of dementia. And in people with Alzheimer's, there is actual nerve cell death, and it's an organic brain disease. That's one of the things we really try to point out. It's not a mental illness. It really is an organic brain disease. When you look inside the brain, there are the hallmarks of what's called plaques and tangles that occur in the brain. So all of those symptoms that we see in people with Alzheimer's, the memory loss, the confusion of time and place, the inability to make good decisions, is because there is nerve damage actually in those parts of the brain.
Alzheimer's disease is an illness that we now understand on a molecular level. So we understand the molecules that are involved in the death of brain cells. So it's a disease that involves the slow, gradual death of brain cells in particular areas of the brain. Under the microscope at autopsy, it's associated with the aggregation of two different proteins. One is a protein called beta amyloid, which is a fragment of a very normal protein that's present in everybody's brain. And the other protein is called tau. It's another protein that's a perfectly normal protein that's in everybody's brain. But for whatever reason, these two proteins independently become aggregated together. When beta amyloid aggregates with itself, it forms what are called plaques in the brain. And when tau aggregates with itself, it causes what are called tangles in the brain. And this is what a neuropathologist looks at under the microscope at an autopsy specimen. And what it is for a patient is a gradual loss of intellectual function that usually, not in all cases, but usually starts with loss of short-term memory, loss of the ability to form new memories. Patients lose the ability to solve problems, to think logically. They lose the ability to navigate, to be able to find their way around a neighborhood, for instance, that they previously knew how to find their way around. They lose language abilities. They lose the ability to think of that precise word that they mean to say that expresses what they're trying to express. And so in the end, it affects all aspects of a person's higher intelligence, the ability to communicate, to navigate, to solve problems, to function independently.
I'm sure the symptoms were there, but I wasn't paying attention to them. I was, as I say, I was in denial about some of the issues. And so I'm not sure that what the later stages will be like or when they will occur. And I'm really not dwelling on it. I notice changes in myself now from what I did 2 or 3 years ago, and I expect there'll be other changes, but I don't really, I could get hit by a truck, you know. I mean, you don't know. This is life, right?
So people can actually die from Alzheimer's. That's one of the things I think people don't realize. Often people may die of other complications, such as pneumonia may develop, but really, as Alzheimer's affects other parts of the brain, it does begin to affect our automatic functions. So automatic functions like breathing, swallowing, really become impaired.
Patients will always experience a tipping point where the environment that they've created for themselves eventually is not enough, and eventually their needs exceed kind of their environment, and they feel like they're reaching a tipping point. It's not that the disease has suddenly worsened at that point, it's just that their compensatory strategies have finally failed.
A lot of people turn away from something that's not appealing, something that's makes them feel, unfortunate or unworthy or whatever. And I don't see any basis in that.
For anybody that's going through it, I just say be with them. Do the best you can for them, and don't feel guilty if you have to place them somewhere for their own care. It's a really hard thing to do, but it's necessary when someone has Alzheimer's.
I think the other important thing to mention to people about, where to seek help, it's not just the professional help they need to get from organizations like the Alzheimer's Association, but also peer support is equally important. So we have support groups that are out there throughout various communities, and I think that is equally important because often families feel like they're so isolated, that they're the only ones dealing with this disease, when in fact there are lots of people out there dealing with this, and they can really share on, in terms of the challenges and also good problem-solving techniques.
I think by focusing on some of the positive things, a person can achieve a very wonderful quality of life. Time spent with family can be very productive and very fulfilling for a patient with Alzheimer's disease. And so I also counsel families to recognize this and to linger a little bit less on lost abilities and to focus on the things that a patient is still very good at and still derives joy and contentment from.
What I would tell somebody if they were interested in listening, that the best thing to do is to live each day as one can. I mean, that's a good recipe for all of us. Not to look too much forward. Handle what you can. And appreciate things. Be grateful.